Aloha kakahiaka. Good morning, everyone. Mahalo, and thank you for being here for AlohaCare's internal webinar series, Enlivening a Culture of Health. Today's our 5th episode, and we're going to start shortly. Before I welcome our teammates, I want to help you familiarize yourself with the Zoom webinar features, which are always a little bit different than the Zoom meeting, and we want to make this as interactive as possible while we remain virtual. You'll see a number of icons on your screen here. As a reminder, please join the webinar live without logging into Citrix or using your VPN. This will help optimize your video and audio and help to make sure that you don't cut in and out or drop the line. We have a few things for you to look at on your screen. And since, we're not able to have these important and sensitive conversations together, we want to make sure that we're utilizing the chat box, the Q&A feature. We're going to have a couple of polls. You can send your questions to us at any time. We welcome questions. We're going to have a facilitated discussion after we do have a brief presentation and overview by our friends at Healthy Mothers, Healthy Babies. Lastly, just as a reminder, we are recording this session for staff who are unable to attend with us live, or if any of you want to rewatch this later. Our recording is of the screen and the audio only, so we're not actually seeing you, and we're not recording the chat box. This webinar is a safe anti-racist space led by the values of Hawaii. We encourage your questions and comments and just ask everyone to lean in and center where we are right now at this time, and it's a pivotal way for us to look forward. With those brief tips to orient you, let me warmly welcome everyone to the Enlivening a Culture of Health webinar series. Our 5th episode will be focused on the importance of maternal and infant health and highlighting new integrative partnerships we've launched at AlohaCare. This episode was scheduled intentionally. We are kicking off National Women's Health Week, and we're celebrating Mother's Day. So we want to begin by honoring all of the moms and women joining us today for this training. For any mothers, grandmothers, godmothers, stepmothers, aunties joining us live, go ahead and insert into the chat and let us know how many keiki and mo'opuna are part of your family. Who is a part of the circle that you care for and that you love, that you're bringing with you today, and are passionate reasons why you do the work that you do to improve health and healthcare throughout Hawaii. Now it's time for us to better understand the social determinants of health needs of our members. We're outlining a strategy right now to address these opportunities in the work that we do across our organization and in the communities we serve. Women, infants, and children are at the core of the domains in the new SDOH work plan that AlohaCare has adopted. As customary in Hawaii, I want to start today's webinar by acknowledging the land and the natural environment as the preeminent source of Mauliola and where our whole health begins. In the photo here is a place that we refer to as Kukaniloko. It's very close to my house and where I raised my own son. It's a place where you will find the most spiritual and sacred center of the island of Oahu, and one of 2 sacred sources of life-giving forces in all of the Hawaiian island chains. Kukaniloko is where our highest ranking chiefesses would go to give birth, where they would come together as a group of women with their healers, their spiritual advisors, and they would welcome this new life as a community together. Kukaniloko is also the place where our highest ranking rulers, our chiefs, would go to learn what it means to be a leader. This is a place where they would actively gain leadership skills and qualities that were led by values-driven ideas, and that they would create action plans to make sure that all of the people that they were entrusted to serve were cared for, were healthy, and well. I invite you to think of a place like Kukaniloko as we talk about this conversation today, and I introduce the amazing Women's Health Week panel that we have lined up for you. As I briefly share their bios, I want to start with our first poll. You're going to see it pop up on your screen. You should see the green box pop up on your screen now. Go ahead and take your vote. And then we're going to share the results later. The first question is in 2020 March of Dime's preterm birth report card. They gave Hawaii a grade. What letter grade do you think we received? Amy Feely Austin, our Director of Quality at AlohaCare, will tell you more about this and provide you that important answer in a few minutes. Amy has previously been the founding executive director of the state of Hawaii's first ACO, the Queen's Health System Medicare ACO. Amy has more than 15 years of experience in public policy, public health, healthcare, and social service operations. She's been deeply involved in healthcare transformation in Hawaii and on the East Coast of the United States. She's a staunch advocate for perinatal health equity and currently serves as the board president of the Board of Healthy Mothers, Healthy Babies Coalition of Hawaii. Sunny Chan is the executive director of Healthy Mothers, Healthy Babies Coalition of Hawaii. She's a loving mother to 3 children, an Army Nurse Corps veteran, and a wife to an active duty Medical Corps officer. She's a board certified lactation consultant and loves to help mothers during their breastfeeding journey. She's passionate about advocacy and social justice for women and birthing people. And in her free time, Sunny loves to cook, and she's learning to speak Mandarin, and she's playing golf with her kids. Princess Leibai is a first-generation Filipino-American born and raised in Honolulu, Hawaii. She's received her bachelor's degree in public health from the University of Hawaii at Manoa, and she's currently pursuing her master's degree in public health, specializing in health policy and management. She's the program manager at HMHB, and she oversees various programs and community outreach efforts, which she's going to share about with us today so that we can help link our members to the great work that Princess and her team are doing. And we have Tanya Smith Johnson. She's a certified professional midwife, reproductive justice advocate, and policy director at HMHB. Tanya is co-author of the Hawaii Feminist Economic Recovery Plan and a member of Birthplace Lab's Global COVID-19 Perinatal Task Force. She's the Director of Outreach, Advocacy, and Education for the Big Push for Midwives. Tanya is an incredible mother, which I have seen myself, to 6 beautiful children, a veteran, and she's served in the U.S. Navy Hospital Corps. She's a spouse to an active duty civil engineer corps officer with 25 years of service. Before I turn it over to Amy, I just wanted to see if we can briefly play one of our recent media clips between AlohaCare and Healthy Mothers, Healthy Babies with this new program and integrative partnership that we launched. It's just about 1.5 minutes, and so I'm hoping that this plays well for you folks to get oriented to what we'll be talking about today.
Healthy Mothers, Healthy Babies is partnering with AlohaCare, and they've just unveiled their new Mana Mama mobile clinic. Sunny Chen, Healthy Mothers, Healthy Babies Executive Director, joins us this morning with all the details. Good morning, Sunny.
Good morning. Thanks for having me.
Of course, very happy to have you because you guys are doing such great work in the community. So before we talk more about the mobile clinic, can you tell us about Healthy Mothers, Healthy Babies and the work that you guys do?
Yeah, Healthy Mothers, Healthy Babies. We were initially established as a statewide steering committee and became a nonprofit in 1992. We're a local organization that's committed to doing whatever it takes to fill gaps in our community. And we're probably best known for programs such as Cribs for Kids or Picopal's New Parent Support, mental health services for mothers. But in partnership with AlohaCare, we recently unveiled our Mana Mama mobile clinic, and we are adding clinical services to the social services that we already provide.
Oh, so great. And talk a little bit more about that. What has AlohaCare's role been, and how exactly has that helped HMHB?
Yeah, so they gave us a $35,000 grant. We were the recipient for the remodeling of the Mana Mama mobile clinic. And their Access to Care grant has been instrumental, of course, because you need money to launch a new program. And they assist many nonprofits, but we were selected because of our goal to provide expanded care to underserved, at-risk populations, moms and babies in our community who just need a little extra help. And although we purchased the van, it was just an empty cargo van that we were utilizing to transport meals and diapers and cribs and provisions, but we didn't have funds to transform it into what it is today.
Yeah, and we were just looking
AlohaCare
at some video of it, and it does look really amazing. Wow, what a transformation. But talk a little bit more about that. I know you mentioned it briefly, but what exactly is the history of the van, and how was it used for community care during the pandemic?
Yeah, so during the lockdown, when we had our mothers coming to us saying that they had food insecurity and difficulties and fears about going out, we transported meals, diapers, cribs, spam, produce, whatever it was that families wanted and what we could get our hands on. And we worked with a volunteer force of over 120 people to help us get those provisions to our families. And currently, we're working together with partner organizations, city and state departments to see how the van can pivot and be utilized to help with the increasing needs of the community, even maybe potentially vaccinations.
Wonderful. And how did this all come to be?
Yeah, it's always been an important goal of ours to reach our families where they are. So, you know, they may have obstacles, transportation obstacles, logistical challenges as young moms or mothers who just need a little extra help. So we wanted to provide a community-based full spectrum of care. And we started the van remodel in December after our last delivery around Christmas time. And we had certain components that were special ordered because it was hard to get certain parts delivered to Hawaii. And we just completed the full process last week.
Yay.
And so in addition to the grant, we had tons of, not a lot because of the pandemic, but close family, friends, and local businesses that pitched in to make it happen.
Wonderful. And again, this is just recently completed now. So going forward, who's going to be staffing the mobile clinic, and how exactly is that going to support the community?
Yeah, so our staff, we're very talented. We have a nurse practitioner, certified midwives, doulas, program managers, lactation consultants, nurses, and therapists. And 2 staff members will be assigned to the van every day. And based on the needs of the patients that they have for the day, they'll be pre-scheduled. We'll offer a full range of midwifery care to assist with reproductive health, preconception, pregnancy, postpartum, well-person care. And like the rest of the nation, Hawaii is facing a physician shortage. And we need to figure out how we can address those gaps and how we can fill those gaps.
Yes.
And utilizing mid-level providers when appropriate, such as midwives and nurse practitioners, is part of the answer. And Mana Mama's mobile clinic intends to do just that.
Wonderful. And for those who are wanting to know more about your services, or maybe hoping to maybe get some help from you folks, where can we head to find out more?
Yeah, you can go to our website at www.hmhb-hawaii.org. You can follow us on Instagram, HMHB Hawaii, or you can just call us 808-737-5805.
Wonderful. And we'll have that link as well on our website, kh12.com. Thank you so much, Sunny, for joining us this morning, and again, for all of you guys that you do for our community.
Thank you so much.
Just a brief video for you. We're going to go ahead and we'll put that link to the video in the chat. It's a great segment with Sunny being featured. At this time, I'm going ahead and I'm going to stop talking, and I'm going to turn it over to Amy, our Director of Quality and the Board President of HMHB. Amy, welcome. Thank you so much for joining us today.
Hi, good morning, Aloha. Good morning to everybody else. I'm so happy to be here this morning, and it's always so humbling to be amongst a group of such amazing women. I really just wanted to have a few minutes to set the tone and really talk about the partnership from our perspective and why it makes good business sense, and then, you know, really turn this over to the experts, the ladies who you will hear from next, who do the work. I think what it really boils down to in one sentence is that caring for pregnant and birthing members and new babies, it just makes sense. It makes sense ethically. It makes sense financially. It really, as a health plan, we have an imperative to provide high quality care and to manage costs, and making sure that we get the best prenatal and postpartum care for moms, and that we're taking care of maternal health during the pregnancy, and even sometimes prior to the pregnancy, and then again after the pregnancy, providing good education to mothers about caring for their babies and caring for themselves. all of this, it just makes sense for us as a plan. So as Kealoha alluded to earlier, I'm going to share with you a little bit about kind of the state of the state. So Hawaii, about 1 in 3 pregnancies and rising right now, unfortunately, largely due to COVID, are Medicaid or Quest births. I see that, the vast majority of people selected B at 41%, followed by A at 25%, followed by C at 20%, and only about 11% of folks shared D, with only 3% at F. So maybe surprising to this group as it was for me, but the actual March of Dimes score that was given to the state of Hawaii was a D for perinatal outcomes and equity. 20% of all pregnant people across the board, not just Medicaid, but across the board, receive no or very late prenatal care. And that's based on the best data that we have. Thousands of babies, excuse me, about 11.5% of the state's live births are born prematurely, and the rates in some rural areas like Hawaii County are worsening. The preterm birth rates are costlier than elsewhere in the United States, meaning that we bear a higher burden of cost when we have a preterm birth. And what I found perhaps most astounding is that for certain measures such as infant mortality, Hawaii is actually doing worse than it did over a decade ago, at 6.8 out of 1,000 births in 2018. So that means that over a decade ago, when we set the 2020 Healthy People 2020 goals, and the whole world was marching towards that future of improved health, improved community health, we've actually stepped backwards from that goal and moved in the wrong direction. So I've done a little research here on our pregnant and birthing members. Some of this you may know. Most of this is based on 2019 data, which was the last normal year that we had. We had about 1,100 live births in 2019. Most of the deliveries were to members living in Oahu, but we had a disproportionate number of deliveries to members living in Hawaii Island and Molokai, meaning that we had a greater percentage of the births there than we should have for a plan our size. Data suggests that the neighbor island moms used less services, including the high-level nursery, than Oahu members, but this is likely due to lesser access and not likely related to a lesser need. And that's based on other statewide data that demonstrates that the neighbor islands in many cases have a greater need for a higher level of care, but they're actually receiving a lesser level of care because of access. The deliveries resulting in level 3-4 nursery are disproportionately to Native Hawaiian and Pacific Islander members. Some of this data is very difficult to look at because it's not disaggregated. We have a really hard time looking at other ethnic groups such as Black mothers and Hispanic mothers because the numbers are so small that they're not statistically significant. But I think it's always important to remember that these are real people that are having really significant issues at a very sensitive point in their lives, which makes it very important for us to ensure that they're getting the best quality care. I will also note that there is significant depression, smoking, diabetes, and obesity in the population of pregnant and birthing people. So how does an optimal perinatal care experience fit with our strategy and goals? Well, there are some very practical ways. Clearly, I think at this point, everybody can tell that I'm very passionate about this, that I love this work, but it's not just about whether or not we love to do this work or think that it's the right thing. It's also about how does this fit with our goals, right? So first and foremost, there are Ncqa measures that we report every year to share with accrediting bodies in the state that are related to perinatal health that go beyond just the prenatal and postpartum that we have in our P4P programs. There are more and more measures that are added to the roster of measures that are related to perinatal health that include things like perinatal depression screening, perinatal vaccination. So we're really being measured on the way that we care for pregnant and birthing people. The state P4P measures, of course, are a subset of those NCQA measures, and they're worth about a quarter this year of our approximately $5 million withhold. Perinatal measures drive auto assignment. So our plan is in order to gain auto assignment, to gain members via auto assignment based on their quality, the quality of the plan. And we have a handful of measures, perinatal measures, as well as the follow-up to hospitalization, and a few other measures that drive the order in which we're assigned people who don't choose their own plan. So that's important business that we want to gain by having high quality care. Of course, we want to improve perinatal care so that we're helping to educate mothers and families about the way that they should be caring for their infants and young children, vaccinating them and so forth. This is an opportunity to teach mothers and families about what they can do to keep themselves and their babies healthy when they come. We have some NCQA requirements around proactive outreach and patient education that we can meet and exceed if we pay attention to this measure and we work with community partners. In younger populations, such as ours, pregnancy, birth, and NICU are always major cost drivers, and they are for us too in our plan. So we want people getting lower cost, higher quality care. We want members to have good experience with our plan and their end-to-end experience of care, particularly when they're pregnant and they have young children and care is really complicated. And there's a lot of care that needs to be received in a short period of time. Finally, we think we have an important role in the community, and the health of pregnant and birthing people should be a high priority. And I think we're moving to Sunny. Thank you so much. Sunny, on to you.
Thank you, Amy. So yeah, as you guys saw from the introduction, we have a very ethnically diverse and multi-talented team of staff. And we come from the communities that we serve. So we truly embody the saying, for us, by us, and we live and breathe that mantra. We have this do whatever it takes mentality to help fill the gaps in our community. We're proud to be trusted in the community through all of the programs and services that we provide at Healthy Mothers, Healthy Babies. Adding the Mana Mama clinical arm really helps aim for us to aim that no one falls through the cracks in our system, and meeting the community where they're at and tending to their social but also clinical needs. We utilize a team-based approach and really elevate the midwifery profession, and you'll hear more from one of our midwives, Tanya, later. But in addition to celebrating National Women's Health Week and Mother's Day, today is International Day of the Midwife. So I thought I would, mention that 2020 theme is follow the data, invest in our midwives, and AlohaCare is truly doing that, walking the talk. And, together we believe that investing in this clinical model of care is fundamental to greatly improving reproductive health and perinatal care for our mothers and infants. So in the next slide, you can see that our goals, it's a very hefty goal for those of you who are aware of the current disparity ratios in the state. Some of the March of Dimes data will highlight that we have one of the worst disparity ratios in the country. But through this model of care, we aim to eliminate racial and class disparities. Our objective through our Mana Mama design is to decrease preterm pregnancy rates. And our newborns will have healthy birth weights, which is 5 pounds, 8 ounces or greater. Improve bonding between families. So we're really talking about mental health and supporting the whole family together through our programs and support services, and helping to improve key perinatal measures indicated by AlohaCare and HMHB working together. Some some examples of that would be honing in on smoking cessation in mothers and family members and postpartum visit compliance, for example. We can really truly, through data and through our work together, really hone in on those goals and see if we can truly make a targeted impact in our community, and improving postpartum depression, anxiety in our most vulnerable mothers. So we know that nationally, 1 in 7 mothers will experience postpartum depression and anxiety, but in the most vulnerable women that we serve at AlohaCare and Healthy Mothers, Healthy Babies, that number is probably closer to 1 in 5. So thinking about that and integrating that in all of our programs is very, very instrumental to improving ultimate outcomes for our families. And so what are we really talking about in the next slide? We're talking about how are we addressing social determinants of health for our pregnant and birthing people? What does that look like in real life? We talk about it a lot. That's like a new buzzword that we've been, as our community has been talking about, but really working directly with health plans, having champions like Dr. Fox and Amy within organizations and health plans is instrumental in decreasing duplicative services, improving care coordination, data collection, connecting to primary care providers, decreasing the workload in the healthcare provider world, and being able to, provide access to clinical care and social services that are available in the state. So we're really talking about the quadruple aim, our strong community partnerships, bridging the gap between clinical and social services, working in close partnerships with our care coordinators, nurses, providers in the community, decreasing the cost to our healthcare system ultimately because we're improving outcomes. And lastly, but not least, aiming to be flexible to meet the unique needs of our members and our patients and our mamas and babies, and that obviously naturally will increase member satisfaction. So Princess is going to discuss more in detail kind of our services that we offer at Healthy Mothers, Healthy Babies, and how that complements the clinical care. And so I will send it to you, Princess.
Working off of what Sunny had mentioned, being able to provide that clinical care to women also allows us to wrap them in all of our social services, especially the programs that we've already have existing and also programs that we've added just in the past year alone. Our team has grown, our programs have expanded, and in this slide you see some of the pictures of what we have done in the past year. And one of our longest running programs, which started in 2013, is our Hawaii Cribs for Kids program, which is the first and only program of its kind in the state, which we provide safe sleep education to low-income, socially high-risk women and their families. We incorporate education about how women and families can minimize their risks and also emphasize the importance on different topics such as keeping up with prenatal appointments and even initiating breastfeeding. In our Cribs for Kids program, we also touch base on the period of purple crying, a program geared at preventing shaken baby syndrome. And since the pandemic, we've actually moved our Cribs for Kids program virtually, which allows the families to kind of complete the online course at their own pace. And upon completion, HMHB staff goes out and delivers these cribs directly to the moms. With each delivery, we try to provide frozen meals, diapers, wipes, dry goods, and other canned goods, whatever we have available that's been donated to us or that we had received through our partners. And another program that we have, which started in 2017, is our Picopal's New Parent Support Program. This program connects and empowers new parents of babies ages 0 to 4 months to build their own village through facilitated discussions in an emotionally and intellectually safe environment. Picopal sets the stage for connection and friendships with peers in your community and helps to make lasting relationships to share and celebrate the joys and challenges of new parenthood. This program is especially helpful, especially during postpartum, to provide support for families that may be experiencing postpartum depression. And in regards to mental health support, On staff, we do have licensed clinical social workers, so it allows us to make direct referrals for the women, ensuring that they receive care as soon as possible. During the pandemic, we were able to launch multiple additional programs, and one of those programs is our community-based doula program. And launching this program allows this program makes doula support accessible to families, especially those who fall under low income and wouldn't usually consider spending the money on doula services. But this program helps us reach into the communities and also helps educate more people. Doula support helps clients know their rights during pregnancy and childbirth, and doulas provide physical, informational, and emotional support throughout their pregnancy. We also launched our Mana'ai food distribution program. With CARES Act funding, we were able to deliver about 300 meals per week to new and pregnant moms through December of last year. At the end of that funding, we continue to distribute food to all of our clients, whether they're in our Cribs for Kids program, offered to our Picopal moms, or any of our doula clients as well. All of them are offered these frozen meals to ensure kind of food security and kind of just get them going. And additional services as well that we provide is breastfeeding support. We do have breastfeeding circles available, Zoom meetings, or they can do one-to-one lactation consultations. And we also provide childbirth education as well. And on the end here, lastly, as Sunny had mentioned, the launch of our new clinical arm, we are able to kind of bridge the gaps in the community and break down barriers such as transportation, time, or even childcare, and kind of bring the office to the patient so that they're able to receive services they probably couldn't receive because they're stuck at home. But yeah, so these are some of these are the services that we do provide. If you guys have any questions about any of this, definitely just let us know so that we can address them.
All right, hello everyone. So I'm up next, and I'm so happy that Sunny mentioned to you all that today is the International Day of the Midwife. I am, happy to be here, presenting to you all, not just as policy director for Healthy Mothers, Healthy Babies, but also as a certified professional midwife, because what we're, learning now is that it's important for us to have data collection. So I'm going to, talk to you about how leveraging data and policy can actually achieve health equity and the ways in which we can do that and how we can do better as a state here in Hawaii. So through data collection and analysis, we're able to understand who is most impacted by certain diseases and health threats. With data, we can monitor when medical systems aren't reaching community needs and goals. Also with data, we can advocate for and create prevention programs that address the needs of community. So here in the United States, it's the elephant in the room that we don't talk about. We were already suffering from a pandemic of sorts. And that pandemic is the maternal health crisis. And now we're starting to see more and more information in regards to who's being impacted, how, and also, recommendations by various different states on how we can do this better. This is one of the realms in which, our partnership and we can do better in regards to serving specific communities here in Hawaii. And those communities that are most impacted are Black, Native Hawaiian, and other Pacific Islander birthing people. And we as a state are failing, as you saw, from the, information that Amy shared from the March of Dimes 2020 report. We have a D, and that's a failing grade. Lots of people in the state, don't realize and recognize that. And also as a state, we don't do a very good job of collecting data, especially disaggregated data. But from the data that we know, these are some of the things that we see. Black women make up 3% of the state's population. And even though that number is really small, 24%, Black women experience 24% more preterm births than any other group here in Hawaii. And it's important that we recognize that. And it's important that we collect this data, disaggregate it, and actually know what's happening to people, even the smallest communities among us, right? It's important that we do such things. Studies suggest that Pacific Islander women have increasing rates of preterm birth, primary cesarean deliveries, preeclampsia, and low birth weight infants. But we need more information. We need more data to understand exactly the numbers and what's happening. But the data is limited. So what are some of the things that we can do better? We can engage hospitals through quality improvement toolkits to understand leading causes of maternal mortality and morbidity. And it's important for us to understand the difference between those, because what we've learned, during the last few months is that people confuse what mortality and morbidity is. And morbidity are those near misses. Morbidity are the clients that, come close to death. They didn't die, but they have these chronic and sometimes acute issues that happen that impact their lives throughout. Sometimes it's just up to the first year postpartum, and sometimes those issues continue on. We can determine those complications that lead to those near misses and not just talk about mortality. It's a point now where as a state, we have to get past just talking about mortality, which we just started collecting a few years ago as a state. And now we need to get to the point to where we're seeing the other things that happen, because what we know now is that for every one mortality, there's upwards of 100 women who are experiencing those near misses. We have to do better in collecting that. And most importantly, those women mostly impacted will be our Black, Native Hawaiian, Pacific Islander, and other racialized communities here in Hawaii. We can standardize data collection for hospitals and healthcare systems and the ways in which they report, making sure that we're seeing that those specific communities and what's happening to them. We can figure out better data metrics to drive policy and move the ways in which that we care for people. And we can perform drill down analysis to identify each healthcare system's specific data, what they're doing right, what they need to improve on, and how we can care for our communities here. Next slide, please. How do we do better? We could collect data to measure progress in inequities and determine whether improvements can be made through policy. We can determine whether those recommendations need to come from community, and it's important to have community at the table to understand what's happening to them. And understanding that data, when we talk about data, yes, it comes from, reports and testing, but also data comes from lived experiences of community. We have to talk to birthing people. We have to, understand what's happening to them. They know what their experiences are, and those things should be collected and compare that with the data that we collect from hospitals, our healthcare systems, and understand what's happening and make those recommendations. We can also address the invisible segments of our communities, those people who fall through the cracks, those people that we don't see and hear, and making sure that we're reaching everybody within the margins. The underserved, those who aren't cared for well, those who've had experiences that need to be recognized on a larger scale so we can do better as a state. These are some of our babies. This is the community we talk about when we say serving community. These are the mamas. Some of these mamas have experienced implicit bias within our own healthcare systems. Some of these mamas have had to advocate in ways in which they shouldn't have to, just to get appropriate and standards of care that we see on the mainland. And there are models for how we do this better. We don't have to reinvent the wheel. We just need to make sure that we make the commitment in doing so. Healthcare for children and families and seniors in our communities require a commitment, not just to the individual, but the collective. And that's the nature of how we do business here in Hawaii. We take care of each other as a complete community. And with critical information on race and ethnicity, if we don't do that, we all pay the price. So it's important that we see community, we hear community, and we take those experiences and make better policies and recommendations.
Thank you so much for all of that beautiful information. I'm going to turn off our slideshow now and bring it back to us here. We put a lot of information for you folks into the chat, and then we also saw quite a lot of questions came in as well. I want to make sure that we get to some of those questions, and I think this is all really related to what Tanya just dovetailed us into of what should we be doing? Where do we go from here? Where did the solutions lie? So some of the questions that came in, there's a couple questions for how do we expand these services and programs? Are you folks looking at offering them in other areas and potentially on the neighbor islands?
So actually, we do have partners already established on the outer islands. So we are able to provide these services, especially since we've moved everything virtually. All of our clients are able to access all of the services. Specifically for our Cribs for Kids program, we are delivering the cribs directly to the moms, or having them arrange pickups at Maui Family Support Services or Hawaii WIC office, wherever our partners are on the neighbor islands.
Great. So maybe just as a follow-up question for you, Princess. So some of your group and individual classes, programs, and offerings that have been virtually based. Now, you can be anywhere in Hawaii and you can sign up for those
Correct.
classes and programs? Okay.
Yes.
Great. Great. I think that was a big question that came in through some of our health coordinators. And then I think that was related to the beautiful new mobile clinic option. And is there a potential to maybe expand more mobile clinics on the neighbor islands as well?
Absolutely. Send an email to your CEO and tell her we want to expand. No, the talks have actually already started as soon as we finish this Mana Mama mobile clinic here in Oahu. We have been scheming away and dreaming about the next mobile clinic, and we have, nothing 100% set in stone, but we do aim on planning in the more rural areas of Big Island potentially. We have partnerships everywhere, so we'll kind of probably do a community needs assessment to see where we go next, but that's definitely in the strategic plan and works of the organization. And as we kind of think about other services like doula services, we do currently provide on Outer Island as well. But honestly, when I say our team, they do whatever it takes. Tanya will just fly out and provide services, her amazing services to Outer Island clients. And, same with Princess and I pre-pandemic, we used to kind of fly and meet our partner agencies. We have over 25 MOUs and adding and counting every day. And we really, really try not to duplicate services and see how we can be value added to already big organizations. One of our, biggest partners are community health centers, hospitals, FQHCs, Catholic charities even. So how can we complement as we support families in Outer Islands as well is definitely always at the forefront of what we do. And so yeah, very important and in the works and always being continuously planned.
Great, thank you. And I know that from personal experience. I was on the phone with Tanya for a meeting, and she was driving in upcountry Maui, going from house to house to ensure that these services were being provided, and that actually the services were coming to the people in need rather than the reverse. And I think that that is just such a demonstrative spirit to the type of work that HMHB does, the mission that you folks are working through, and the values that you bring as you create these programs and then you actually articulate them. So I just want to open that up a little bit as we dream big. There's a question here of potentially doula and childbirth education classes becoming a covered benefit with AlohaCare and HMHB. I think let's take that for a ride for a minute here and just try that on for size of what does that look like, and how can we best meet folks' needs? Is that something that you're hearing as a goal and something that is desirable in the folks that you're serving?
Well, I'll take that, and then I know that Tanya will have much to add to this as well. But Dr. Fox and I just recently had a conversation about this, and so absolutely, childbirth education is embedded within our programs and our services. We strongly believe in advocacy and childbirth ed, and just educating our families about how to empower them and be able to be advocates for yourself, in addition to the advocacy and the empowerment that we do in order to help our families. But in the world of doulas and midwifery, if you guys think about it, it truly is breaking down access issues within our population, most vulnerable mamas. traditionally. Same with like I'm a lactation consultant. Like you weren't able to access these types of services if it separates the haves and the have-nots. So we're truly centering the most vulnerable populations together, and we're not doing it on our own. We're doing it with health plans, with advocates within the health plans like Dr. Fox and Amy, and it wouldn't have happened without the executive leadership, but also the individual provider relationships that we've built in the last 29 years that we've been here. And really we're working towards reimbursement models. What's the best way to put it, Dr. Fox? It would be like value-based payment models, and truly convincing the public and MedQuest and working together to say this should be a covered benefit. And I think as a state, we're definitely on our way there. We have a lot of legwork to do. It's going to be an all hands on deck approach, even with midwives achieving state licensure recently. There are barriers for families to access midwifery care. So we're a little bit behind with doula reimbursement, but I think that definitely can be on the table as we talk about next steps with AlohaCare.
Yeah, I can add as well. So Sunny makes a point about kind of what's reimbursable and what's not, and what other avenues are, right? So we can kind of be creative about how we reimburse certain services, or how we arrange for services that are not traditionally covered benefits. The other things that we can do is for certain benefits, and to the question specifically, I believe childbirth education is a covered benefit. I think currently right now doula services are not, and lactation is in certain circumstances, right? So some of it becomes a policy issue and an advocacy issue, and this is not unique to Hawaii. I actually have some friends from Rhode Island that are just now in the middle of advocating for a bill to make doula services coverable by Medicaid. So this is happening everywhere. There's kind of this wonderful revolution of folks that are saying, hey, these supportive services have a dramatic impact. You can clearly see it in the data that these services have a dramatic impact on the outcome of the mother and the baby. And covering them is inexpensive, and it has far-reaching benefits. So we can do all sorts of things. Sometimes it's a matter of adding something as a value-added service or part of a package that we support through grant funding or some other payment model. And sometimes it's just about advocating to the state to start, covering things that they may not have traditionally covered. And again, that happens everywhere. So this is not unique to Hawaii. It's not something Hawaii is necessarily doing wrong. It's just traditionally certain things have not been covered. And so we have to start thinking about moving away from that. And I think many folks in our state are beginning to think that way, which is why we recently had that change to add midwives as providers. The barriers are still there. And as Sunny mentioned, barriers, for example, of now that the state has allowed midwives and allows them to be licensed and to practice, they may not yet be recognized by Medicaid. So now we have a process to go through, even though Medicaid would like to have them, where we have to go through the process of figuring out how logistically they're billed for. And so these are some of the barriers of things that can be quite frustrating, where I think everybody on this call, if we could flick a switch and say, okay, well, this is allowed now, let's go. We would just do it, and we would all have much better information for you right now about the wild successes of our programming. But it can be very, very tricky and rife with barriers.
Let me chime in.
Go ahead, Tanya.
Please.
but let's just dream, right? Let's dream. Let's not think about, you know, the legislative efforts and the policy efforts that need to come for us to do it. Dream and think what AlohaCare can do within itself, right? And if instead of having these things kind of compartmentalized, like, you know, someone has to find childbirth education and that's separate from, you know, them birthing, and then someone has to find, you know, a doula and that's separate. What we're trying to do here at Healthy Mothers, Healthy Babies is just make that all encompassing. And so when we say wrapping people around services, is literally what we mean, right? So, you know, current clients I have now, right, I'm acting as, you know, I'm a midwife, but I'm acting as their doula. And so in part of that, in just the way the midwifery model of care works, I'm educating them as well. So they get childbirth education. So imagine if we could think of it in those ways in which we're just like, we have a birthing person. They need to be educated about, you know, this experience that they're going to have. So let's just do it. You know, they need a support system, especially now during COVID, right? Let's offer it, you know, and it's a part of them being a part, you know, of our program. And that's, you know, and that's what the beauty of Mana Mama is, and the beauty of what Healthy Mothers, Healthy Babies does. So it's a matter of us saying that's what we value and that's what we want and that's what we're going to give, and figuring out those other pieces of, you know, who pays for it, where does it come out of, and in those ways. But it's a matter of us saying, like, that's what people deserve, you know, and that's what people should have. And it really could be forward thinking and radical in the model for what other people do.
That's a beautiful segue to our the question I wanted to pose to all of our panelists today. You know, HMHB is coming up on your 30th anniversary. Where do you see this work in 5 years? And what do you want to optimize for the health of women, infants, and children when you start to dream big about that work? And I think that that's a really important question. It's not just your anniversary. I feel like it's the community's anniversary, right? I will share that in a past life, in a past hat, I was able to work with HMHB. We developed a lactation and breastfeeding intervention for Native Hawaiian mothers to increase breastfeeding rates 12 weeks postpartum, because we had the lowest rates of breastfeeding in the state. And it was really HMHB that put those programs and services together, and we watched that intervention group change. And then how that spread. It actually spread to their family members. It spread to their sisters, to their cousins, to their nieces, to where we actually created a movement. And so maybe that's the question back to our panelists today. What do we want to optimize? Where do we want to be in 5 years?
Great. So I guess I am taking that question. Well, in 5 years, we'll see if we're dreaming a mobile clinic van in every, not just every island, but even maybe multiple on certain islands. You know, creating being able to engage not just AlohaCare, right? Because we do have a lot of values, you know, being a nonprofit organization, just like AlohaCare, you know, there's a lot of things, there's investments from a business standpoint that makes sense for both of us to partner, but to be able to show that to other health plans and truly be a model for the rest of the country. If we're really, really dreaming, I don't know if 5 years, maybe 5 years is feasible. And when we're talking about elevating mid-level providers, we have Ncqa, and you know, as our midwife, but other midwives on staff as well, and a nurse practitioner who's our clinical director. So elevating, you know, mid-level providers, case managers, perinatal support staff, doulas, all working together in the same continuum of care. And potentially a freestanding birth center. I know that we've been talking about that, and if we're dreaming, that would be our dream. And to be able to truly encompass how we take care of mamas and their babies best in a safe, non-biased setting, you know, from the people, for the people, that would be our dream. And now that I said it, I know we really have to move towards it. We've been talking about it for a while now internally. But yeah, I mean, Amy as our board president, she's got great vision, and her and I have really great like partnership and thinking about maternal child health. We're grateful for the partnerships we have today, and we're really aiming to elevate those partnerships and improve maternal infant care and take it to the next level for the state.
Oh, let me go, please. I would, in 5 years, I would love to see just a swath of Ncqa Native Hawaiian midwives walking around, where there's so many to where you can throw a rock and you find one, to where it's not something that is extinct, to where it's the norm, to where we see a midwife for every community, and those midwives can be housed at this lovely birth center that we create that can elevate the midwifery model of care, to where we have, you know, more Black and Native Hawaiian and Pacific Islander lactation consultants, you know, where we're just literally uplifting the force in every single way, to where a community sees themselves and their providers and feel safe. They feel cared for and they feel loved and held, to where those services at that birth center can be covered by Medicaid and insurance, to where there's no out-of-pocket fee, to where people can access it and actually, you know, get the benefits that the haves have, you know, people who can pay out of pocket for all the concierge lovely services, to where that's just the norm and that's just what we do. And those, you know, and we move from that D to A+ because of it, you know, to where Hawaii is literally taking this moment and seeing what's happening and doing the right thing and putting in the right policies and doing the right programmatic things to make things better, to where people look at Hawaii and say, wow, they went from a D to A+ because they got it right because of programs and partnerships like this.
Ladies, this is Amy. I just wanted to actually pose a question that I think some people may have. So we talked a little bit about the midwifery model of care and about things like freestanding birth centers and the benefit of that. But I think any of you could probably answer much more eloquently than I could, even though we don't have a ton of time here, what makes that ideal for women, and what is like the difference, I guess, between that model of care and the model of care that we have right now?
I'll go. That, you know, as a midwife, the midwifery model of care really just centers the client. You know, it's not about me, you know, as the provider, you know, to where the family is centered, their needs, where they're, you know, they're able to move and make decisions about their care that is autonomous, without pressure, without this feeling of authority telling them what to do. To where we are the auxiliary people and the family is at that center, community is at the center, and we are of service to them, you know. And I think the model we have now is to where, you know, and I like to call it the medical industrial complex, but to where, you know, people don't feel they have that decision-making power, to where, you know, people don't feel like they're being cared for and seen or even safe. You know, let's just be real about it. You know, Black, Native, Indigenous women are not safe in these places. And we can, you know, debate about that all we want, but, you know, you can look at the data, you can talk to people's experiences. When we have someone as rich as a Beyonce or Serena Williams having the experiences they're having in the hospital, something has to change, you know, and many people believe that that's, you know, moving to the midwifery model of care, to where people can access, you know, care providers who are from their communities, who look like them, who center them, and actually treat them like human beings, you know, who have decision-making capabilities about their care, whatever that looks like, you know, and being able to birth in a birth center to where it's like home, you know, not to where, you know, people feel like they're walking into this place that's in many ways like a prison, you know, where they don't have, you know, this autonomy that they feel like they, you know, they can and make the decisions they want. So imagine having this birth center with midwives there, to where it's, you know, where birthing in a birth center is normalized, where there's not this stigma around of, you know, birthing outside of a hospital with a midwife. And really just, you know, going back to what, you know, our ancestors did and what communities did, you know, those spaces were held by, you know, midwives and healers and birth keepers and women, who cared for community, and it was of service. It wasn't about ego. It wasn't about me as the authority figure telling people how they should, treat their bodies and how they should birth. So where, imagine, women walking around outside unattached to IVs and in the garden as they're laboring. Imagine, us having conversations about, informed consent and refusal, where people can refuse things if they want. And it's not threats of CPS coming to take their children if they don't do certain things, or threats of getting kicked out of care. All of these things, just centering back to, who's important here, and the person, the people who are important are that mother baby dyad. And that's what we need to get back to. Whatever that care looks like, that's what that needs to be.
Thank you so much. Princess, I want to give you the wrap-up closing thoughts before we end today's really important webinar and the discussion that we're having. I'm also going to launch the last poll while Princess is talking.
I think that's what makes HMHB such a great team, is that everybody on board has the same dreams. We are all on the same page. We're all looking at the same goals, and really everything that I could say, Sunny and Tanya probably says it better. So I really do agree with what Sunny and Tanya are saying, and we are looking at making really big changes and doing things for the community with HMHB and the team that we have, and all the growth that we have to come.
Thank you all so much. This was just a really great way for us to lean into all of the special commemorative days that make up this time period in the month of May right now. But we're also not just taking time to celebrate the wins, we're also making sure that the areas that continue to have gaps and where disparities continue to lie are being brought into those solutions as well. I really want to wrap up by sharing a deep mahalo and thanks to Amy and Sunny, Princess, and Tanya from Healthy Mothers, Healthy Babies Coalition of Hawaii. As you're taking this last poll, everyone here is actually voting in the direction of why this issue is systemically very important. In Hawaii, we have higher birth and fertility rates than the US average. We're knowing one thing for very certain right now. Native Hawaiians and Pacific Islanders are the only race and ethnicity group nationwide that is continuing to increase their birth and fertility rates. And part of that has to do with a really young population. And so as we're talking about right now, services, covered benefits, we're also definitely talking about the 5 years from now and another 30 years of partnership existing with the community, with clinical providers, and all of the great work that's encompassed today in this very brief conversation with HMHB. I really want to thank AlohaCare's leadership. Our CEO is on today, and I just want to thank her again for prioritizing the needs of the birthing members that we serve, and all of our leadership who has stood by these types of integrative partnerships in the way that we look to the future, and another 5 years for AlohaCare. We want to thank all of you for starting your day with us to enliven a culture of health throughout all of the departments and lines of business that AlohaCare touches. If you have any questions, please continue, reach out to me or Amy. I'm going to just ask as we close if Sunny, Tanya, and Princess feel comfortable. We've had questions if you can share your contact information. Our staff would love to get in touch with you and be able to link those services directly with our members and your clients. We're just, again, we're so thankful. We're so generously proud of this partnership that we've created in a short amount of time. And we do feel like it's actually just the beginning. We know that much more will come Thank you all so much to all of the moms, the grandmas, the godmothers, the Hanai moms, and the aunties. We wish you and celebrate with you a very, very happy and full and loving Mother's Day. And to all of the women and wahine and feminist advocates that we have with us on this call, happy National Women's Health Week. We're in this together. Thank you so much for your leadership across AlohaCare. You truly are part of the way in which we change for that better optimal future. Thank you, everyone. Be safe. And we look forward to connecting with you at our next episode. Aloha.